I routinely get calls from primary care physicians, or I reach out to primary care physicians, and I'm exchanging my recommendations with them about what medications may be added or subtracted or altered somehow for a patient that I see weekly for 45 minutes, and they only see, once every 3 months, once every 6 months, or once a year. And also, prescribing psychologists or psychologists in general are faculty members, are people who are embedded within residency programs teaching primary care physicians, resident physicians on interviewing skills, interpersonal skills, motivational interviewing. And in New Mexico, they even have prescribing psychologists teaching resident physicians clinical psychopharmacology. So we're actually teaching physicians now our knowledge about mental health and psychopharmacology.
So in terms of coursework, in terms of background knowledge, would you put it at par in terms of the biological side, but idea of medicine?
I would. I think what gets confused is really the sequence of training. So as a doctoral level psychologist, I get a bachelor's degree in psychology, and then some people go on to get a master's degree in psychology and then get their doctorate, which can take 6 to 8 years. And then after that, they get the biomedical training in pharmacology, clinical medicine, psychopharmacology, all the pathophysiology and the chemistry and the neuroanatomy and all that stuff. We get that afterwards. Whereas physicians, as bachelor's degree people, they usually take pre-med courses like inorganic chemistry, physics, and then they go to medical school. The first 2 years, they get crash courses in biomedical training, and the rest of their medical school training, the years 3 and 4, is all clinical rotations. And then they go on to do more clinical work in their residencies. So really, it's just the sequence of things. Prescribing psychologists do the biomedical, psychopharmacological training after all of their schooling in psychology and doctoral level training.
Okay. So this is called the Social Exchange Podcast, and the ante for being on the show, I guess, is to do this segment where I want to paint the other side's views extremely charitably. What are some legitimate concerns from your opposition? What is the best case that you've heard for somebody saying, hold on a minute, should we think about this? Maybe we shouldn't have psychologists being prescribers. Anything come to mind?
Well, nothing. There's one thing that comes to mind. I do want to be fair, and I appreciate the diplomacy. There's no question that physicians get substantially more classical biomedical type training in a broad range of biochemical or medical training. But if you look at physician assistant and nurse practitioner training models, there's no question that prescribing psychologists are at least equivalent in their biomedical training than nurse practitioners, for example, with a master's degree in nursing. But they also bring to the table this huge reservoir and skill base in psychology, in mental health, diagnosis, treatment, assessment. And so that ought not be discounted. I think that they can really help, again, reduce the overemphasis on medications while still knowing when it is appropriate to help people with pharmacotherapy.